we're going to take an actual patient, opened up an actual chart, and I blacked out the name and all the identifying markings that will protect the innocent. But we're going to go through from start to finish how we help a person in this office, specifically from the beginning all the way to the end. What steps do we take and what do we do? And we're going to talk about this person's results in the process. So this person who had come into us was referred in by another health professional, a nurse practitioner, who when she had come into us told us that the nurse practitioner told her that we had changed her life and her life was falling apart, and she really wanted us to change her life as well. She had been suffering with a lot of symptoms for many, many years and felt too young to be dealing with things the way that she was dealing with them. So I'm going to go through her line of symptoms, her list of symptoms. I'm going to go through her blood work. I'm going to go through what we found and exactly what we did and what those results were. And you can possibly apply it to your life. If you're someone who has lost hope with your health, if you're suffering with any health condition and you want to feel better, there's hope. So at the very least, we want to be able to give you hope on these videos. So some of the complaints she had come in, I'm going to give you her list of complaints. We have a list here. She had complained of fatigue, which is the second most common complaint we have in this office from people who come in with chronic illness, is fatigue. Also had weight gain. So she was 5'5" and 204 pounds. She was diagnosed with diabetes, and her A1C at the time was, we're going to go over her blood work in a second, but it was 9.1, which is way too high. Very high blood sugar in a very dangerous situation. She also experienced upset stomach and stomach pain, water retention, so there was swelling all over her body, but especially in her lower limbs. Her temperature regulation was hard for her, so she was hot at inappropriate times and cold at inappropriate times. She had pretty severe anxiety, which had caused her to limit her social life and limit how she was living her life. She experienced depression as well. But the interesting part about her depression was that if she didn't have all those other prior symptoms, she probably wouldn't be depressed. You know, it was really because she just felt so badly all the time. She had mood swings. She had insomnia, so she couldn't sleep. She couldn't fall asleep or stay asleep. She also had bloating and ear pain and gurgling. She had an unusual gurgling sound in her ear that, you know, we uncovered in our exam. So, in our consultation. So when a person comes into us, we do sit down and we don't just do a brief 10-minute talk. We get deep into all the different issues a person might be dealing with. And I get the feeling that in some doctor's offices you might go and you might feel like, do I really want to mention this or do I not want to say this? Is it important enough? Well, here in this office, everything is important. In fact, I dig as deeply as I can to find as many symptoms as I can, because those are going to help me get to the bottom of what the cause is. And if we don't get all those symptoms, then we may miss something. And if we miss something, then that could make the difference between a successful case and an unsuccessful case. So I had to pry that ear gurgling out of her. But it did turn out to be one of the most annoying things that she had to deal with almost her whole life. So those were the symptoms that she came in with. So her other findings, she also was diagnosed with hypertension. And she was on 4 hypertensive medications. She had sinusitis and had surgery back in 2011. She had a goiter and had nodules. And she had tubes in her ears for years to try to help that gurgling, and the tubes in the ears didn't do anything, didn't help her at all. She also had a hip replacement, and she also had told me that she, quote unquote, needs her knees done. And I hear that phrase a lot in this office. I need my knees done. Well, maybe if we can improve things physiologically in our body and decrease inflammation, you might not need to get your knees done, even if it's bone on bone, which was this case in her case. And by the way, she came in here, her main thing was because she was falling apart all over, and the woman that referred her was falling apart in a similar manner. But the main thing she really wanted to deal with was the fatigue, the upset stomach, the weight gain, and the anxiety. And all the other things she wanted help with too, but those were just not as major. We had looked at her toxic load, so we identify in a person where their toxins might be coming from if we can. So if you're a landscaper, well, pesticides and herbicides are probably going to play a big role. If you're a dentist and working with silver fillings and amalgams, mercury is going to be a big role for you as well. Same thing with a lot of different professions. We try to identify what that is. So she had those silver fillings in her mouth. Those dark silver fillings, if you have those in your mouth, they contain a large amount of mercury, and the mercury vapor that comes from there is toxic to our bodies, and your body is going to detox some of it, but there'll be a portion that's going to be stored in your body for years and years. So mercury we knew that she was going to have that. She also had frequent antibiotic use, and we'll talk about that in just a second. Her medications, Benicar, Bisprolol, which both of those are high blood pressure, Glimepiride, which is a diabetes medication, aspirin, Chlorcon, which is to prevent prevent low potassium, furosemide, which is a diuretic, clindamycin, which is generally for acne, but she took that anytime she had to have her toenails cut, and whenever she needed dental work, she'd take that antibiotic. And that was pretty frequent. She'd take that frequently. She also took Nexium because she had GERD and reflux. She took levocitrazine, which is an antihistamine as well. And she got cortisone injections twice a year. Every year, twice a year. She was on 4,000 IU of vitamin D. She took a multi, and she took magnesium. So those were the things that she took when she came in. And that's a long list of medications and a kind of short list of vitamins, but at least she was on something. At least she was on vitamin D. Her doctor did put her on vitamin D, and I was proud of that. But a lot of those medications have their own side effects and symptoms. And if we're treating one thing with a medicine, we may have to treat the side effect to that medicine with another medicine. And then before you know it, you're on 15 medications. And that seems to be what has happened with this lady. So that was our current state of affairs. When she came in, we uncovered a lot of things in our first consultation. And let me tell you what we did. So, before I do, let's talk about her blood tests. So these are her blood tests. Now, I'm going to go over just the highlights of this, and we'll just keep it. I'll try to keep it as short as I can. So the hemoglobin A1C was at 9.1. We want that to be under 5.5, ideally. I could live with 5.7, but if it's over that, then it's too high, and we're starting to have other problems from having elevated blood sugar. She was at 9.1, and she was on medication at 9.1. So that's really high. Her fasting glucose at that time was 158. I like it to be under 90, ideally, but if it's under 99, we can live with that as well. Some of the other things she had total protein at 6.3. We like that to be between 6.9 and 7.4. And so that was too low. She wasn't absorbing and digesting her protein properly. Again, low globulin, which also points to the same thing. Her liver enzymes were very high. Her ALT was 43. I like that to be between 10 and 26. So we knew that there was some liver congestion in there, and there was a problem somewhere with the liver, and there was probably some fatty infiltrate of the liver, although we didn't have any ultrasound to go by. When you have an ALT at that level, there probably is fatty liver. She also had very high cholesterol and triglycerides. In fact, her total cholesterol was 378, and her triglycerides were 667. So everyone knows what your cholesterol should be, so I won't tell you that number. But triglycerides, I like triglycerides to be under 100. So 667 is really a problem. When we see something that high, there is a possibility of some familial or genetic predisposition to that. So that was in the back of our minds as well. But that was super high. We were worried about that. And let's see. That's about it. So her white blood cells were high as well, which also indicated to us that there's some infection. So that was her blood test. So we take the blood test, and that's a really important aspect of this stuff. And everyone should have their blood tested and looked at in a functional way so you can see pre-disease coming down the pike, but hers showed clear disease. Then we also tested genetics. We look at genetics in people to see genetic weaknesses. Not enough people do this, not enough doctors are familiar with how to do this genetic aspect, but it can give us a lot of insight. So in her case, she had a gene SNP called the MTHFR. Now, it was the less severe one. There's a 677 and a 1298. The 1298 is less severe, but she did have one of those. That would hinder her ability to methylate, to make hormones, to make energy, and to detox. So we knew she had an inability, or already one hand tied behind her back because of that. We also tested and found PEMT, which is a gene SNP that shows the ability for us to make our cell membranes properly. So it also has to do with your liver. And we knew she had some liver issues, both from the fact that she had high blood sugar and also from the high liver enzymes. So PEMT, she had 2 out of the 3 gene SNPs for that. She also had MAOA, the slow form of MAOA, which has a lot to do with mood swings. It has to do with insomnia. Both of those things that went right to her clinical picture that we talked about before. So there were 3 very relevant genes that were associated with her symptoms and her case, and we had to take care of those. We also do some specialty tests. So some of the specialty tests that we do here identified that mercury was indeed an issue, that heavy metals were an issue, and probably associated with the liver. Cadmium specifically was a big one for her. There were antibiotic residues, which is no surprise because she was taking that medication when she got her toenails clipped, which was probably pretty often, and whenever she had dental work done, in addition to the other things she was dealing with and taking the antibiotics for. We also found candida. So candida is a fungus that is opportunistic, and when there's gut problems or inappropriate diet or inappropriate immune cell function, though that candida can expand and get way out of control, which it was with her. There's also Campylobacter, which is also known as H. pylori, which was probably the whole cause of her stomach pains and issues. And when we treated that and cleared that up, the stomach pain went right away. So those were her objective tests. Those are the things that we found when we did our testing. So when you have a person who comes into you like this, to me it's when you're suffering with those severe symptoms for such a long period of time, a person has to be really motivated and ready to make changes. Because if this person wasn't on board with us and wasn't ready to do all the things I was asking her to do, she would have not been able to succeed. But because she was so fed up with what she was dealing with, she told me she was willing to do whatever it took, and whatever I asked her to do, she would do. Including if I told her to go outside and eat a teaspoon of dirt, she would do it. And I said, okay, that's good. And she was motivated, and she did what we said. So what did we do? We changed her diet. And it's very similar to the things I talk about every single week on this weekly Facebook Live. No sugar, low carbohydrate. There were some specifics for her case that we talked about, but it's not an easy thing to do. But if you want to be healthy, you have to do the things that may not be easy. And she was great with that. She was awesome. So we changed her diet. That was the first thing. We also went through some special homeopathic type specific detox that would get rid of these heavy metals and these antibiotic residues and these infections. And we also had to give her supplements that were going to help feed her body. So in any case, we have to remove toxin. That's like removing a splinter from a wound. We have to get those splinters out before that wound is going to heal. Once we remove those wounds, then we have to take into account the blood work, the genes, and our other specialized testing, and give the body what it needs that it can't produce. Enzymes that aren't being produced properly. Specific detoxification support for the liver, which she needed. And when people come in with diabetes like she did, most people think of the pancreas and they think of insulin, which, rightly so, that's a part of it. But the liver is one of the main storage parts of glucose, and is stored as glycogen. So if the liver isn't right, your blood sugar is going to be very difficult to keep normal. In addition, her adrenal glands were completely wiped out after years of struggling with all the stuff that she was going through, and and it's no wonder that happens. So her thyroid was also off because all those things communicate together. So we supported her in that way, and we completely changed her life. So let me tell you what happened with her. She wrote us a testimonial, so we have her testimonial. If you want to look at it, you can just ask us and we'll send it to you. but her fatigue completely went away. Her stomach, upset stomach and bloating was gone completely. She had no more of the swelling that was in her lower limbs and lower legs, and she wasn't puffy anymore. So when we hear people talk about how they feel puffy, oftentimes that's inflammation. It's almost always inflammation. So that inflammation went way down. She was feeling great and happy, so the depression was gone because, again, she was feeling better. She was able to fall asleep, and most nights was able to sleep through the night. However, insomnia was still something we still have to work with and work on. Her A1C, which is her diabetes number, went down to 6.3, and again, I like it under 5.7, but she was at 9.1 when she came in, so it went down a lot. Her fasting blood glucose went from 158 to between 85 and 106. Her liver enzymes went down. Her cholesterol and triglycerides went down, and they were cholesterol went from 378 to 291. Triglycerides went from 667 to 315, so we cut those in half. Her white blood cell count went back to normal, and she went off a bunch of medications. So her high blood pressure medication, totally went off her high blood pressure medication. Her diabetes medication, she cut that down by, she cut that down dramatically. So she's almost off her high blood pressure. Her diabetes medication was off of the diuretic, was off of the antibiotic, off the Nexium, and off of the antihistamine. And I don't believe she's had a cortisone injection since she has seen us either. So she stopped almost all of her medications. Let's see. In 6 months, I lost 27 pounds, have more energy, I'm not depressed, my stomach doesn't hurt, my sugar is down to normal, and my A1C is down to 6 from 9+. My medication is cut in half, and I hope I won't have to take any more. Now I can say Dr. Wallace changed my life too. Thank you, Dr. Wallace. So it really wasn't me. All we do is set a person on the right course, identify what the splinters are, help take them out, and then we rely on the patient to do what we ask them to do. And she did that. And then we also rely on time. We need time for the body to heal, and that's what happens in most of the time. So her life was falling apart. So if you're someone out there who is dealing with something that you think that there's no help for, if you're down and depressed that you've been given this diagnosis, I know how that feels. I would do the same thing. But don't give up. There's always something that can be done. Now, maybe we can't have such a dramatic turnaround like we did with this lady, but maybe we can improve you 50% or 80% or 20%. But there is some hope that can happen. So don't ever stop, don't ever quit, and realize that there is potentially hope, whether it's here or whether it's somewhere else. So I recommend to everybody, at the very least, watch what I talk about with regard to food. Spend some time getting that diet better. Lower sugar, lower carbohydrate, more fat, moderate protein, and a lot of vegetables, right? We need to do that. Start taking some better care of yourself. Exercise. Try to take some stress relief time for yourself. And if you are suffering with certain symptoms, then give us a call. We can run a full blood test. If you have no symptoms at all, but you want to be as healthy as you can into the future, give us a call too. We can just run a simple blood test and see what we see. Because whether you're healthy or not, there are definite identifying things in your blood test that can tell us that something's coming down the pike. And if we can head that off before it comes down to you, then maybe you can prevent something from happening. So I hope that was helpful to you. I mean, that's what we do with everybody that comes in here for a metabolic condition. We look at things that way. So if you want to have that done for you, give us a call. We can do that. And if you have questions about what we do or what tests we run or ways you can kind of do this on your own without coming in here, then email us.